Welcome back to Yahoo Finance Live. Let's look at the continuing COVID-19 pandemic. And encouraging news, case counts are falling while the U.S. for the first time in months saw case counts as less than 100,000 in a day. We're joined now by Dr. Adrienne Burrows, family medicine physician and CEO of CFP Physicians Group. So, doctor, we're hearing that these case counts continue to fall, encouraging news that we're under 100,000 cases in just a day, which still is an extraordinarily high number. But where would you classify where we are right now in this pandemic?
So thanks for having me on, Kristin. So I think that that is a wonderful news. Obviously, though, when we've had news like this in the past, we have complicated that by continuing to break down in terms of not wearing masks again, not social distancing. And so I'm cautiously optimistic. Of course, yesterday was another day of gathering with the Super Bowl. And so typically within 2 weeks of these gathering events, we usually see a spike again. And so I would not be surprised to see another rise within the next 2 weeks.
All right, talking about the mutations and the different virus strains that we have, I was reading news out this morning that the AstraZeneca vaccine doesn't work well in South Africa. Now, we keep hearing that these vaccines will work against all of these strains. I'm wondering, however, if there is a possibility that those headlines are going to start changing sometime soon and that we're going to be hearing, okay, well, actually, the vaccine isn't as effective as we originally hoped and thought against some of these variants.
So we do have, we are dealing with these variants and we'll be dealing with more variants as time goes along. I would anticipate we'd even have a US variant at some point. The reality is that, we've got the Pfizer vaccine, which we've been using, the Moderna vaccine, and so far there's not evidence to support that they don't work against the variant. So that's something to really consider. We're talking specifically about the AstraZeneca vaccine, which honestly has had questions from the very beginning in terms of its efficacy. I've had personal questions about the data that was submitted by AstraZeneca, and so it doesn't surprise me necessarily that for this particular strain from South Africa, that it's not as effective. But I wouldn't go ahead and classify all the vaccines as potentially non-effective because the other ones seem to be doing just fine.
Is there a scenario at all where, we don't backslide all the way, to a ground zero, but that we essentially get into this situation where we're almost up against this kind of like a losing battle against some of these variants, some of these strains, particularly as you mentioned, folks really are tired now and they're starting to take off their mask. You mentioned Super Bowl parties yesterday. I'm wondering how much these variants, these mutations are really, changing the game right now.
Yeah. So again, if I was to use an analogy with the flu every year, we do have mutations in that as well that we deal with. And so I'm not surprised by the mutations. It's a very smart virus. And again, it doesn't make the virus more aggressive. It just makes it a little bit easier for you to catch. And so it's something that we're going to continue to struggle with. And I agree, as people get COVID fatigue and stop doing the things that we know work, or at least work in terms of decreasing your risks, in terms of wearing the mask and distancing and doing the things that we need to do. As long as we keep doing those things and be vigilant, that will decrease our risks. But I do anticipate going forward that we'll be dealing with this and the mutations and the variants for quite some time.
Does any of this change some of the calculations in your mind around some of the restrictions that we currently have in place and also some of the restrictions that we've been lifting? New York City says that they're going to be reopening middle schools this month, which is huge news. I know many parents are pleased to hear that. But we, of course, continue to hear that, these strains are out there while the vaccination is picking up speed. It's not where a lot of folks say that they wanted it to be right now. So how would you be approaching some of the restrictions and some of the orders that we have right now, both on a state level, but also a national level?
So I think that one of the things that, and it's difficult for everyone, for the general public as well as from the healthcare field and the politicians is that, we're not going as fast as people would like us to go, and certainly not as fast as we want to go. I've always said that if you're going to open schools, you want to make sure that the teachers, as the frontline workers in that area, are vaccinated, right? When the children or the students get COVID-19, they typically have pretty, non-aggressive courses, but the teachers, depending on the age groups, are more at risk. So I have no issue with the schools reopening if the teachers are vaccinated. And I think that if we do things in a stepwise fashion, I think that's where we're going to be successful. What we've had so far is chaos, total chaos across the country in terms of the vaccine rollout, who gets it when. Some people are skipping the lines. These are the things that are causing issues. But if we do it in a stepwise fashion, I think that we can be successful.
I'm wondering, you were talking a little bit earlier about that pandemic fatigue. I'm wondering what some of your biggest concerns are, at least when it comes to these case counts and some of the hospitalizations, what your biggest concerns are right now. I know you mentioned that in 2 weeks you're anticipating some sort of a spike. I'm wondering, as we continue to get into warmer months, we're now in February, once March, April, May hit, where you think we are going to be, especially as folks, younger people especially, which are frankly spreading the virus the most amongst everyone, say, hey, I'm going to go to the park, I'm going to go see my friends, I'm going to the beach, and I'm going on vacation.
Yeah, and I think that that's where we're going to be. I think that we will probably have a rise in the numbers just because I'm in Florida. Tampa won the Super Bowl yesterday. There were people in the streets all over the place, having these parties, and that's where the spread is coming from. And you're right, the younger people are more to blame, if you want to say that, for the spreads because when they do get COVID, they tend to do pretty well. I do anticipate that as the warmer months move along, because we've had a year basically dealing with COVID and being, quote, in captivity, as a patient told me this morning, people will start to go out a lot more this summer. And I think that as time goes forward, we may see even more of a spike going forward. Hopefully by then, we'll have more people vaccinated, but I think we'll be dealing with this again, much like we did last year, with these ebbs and flows in the virus.
Absolutely. I've been looking on Instagram and I thought everyone in Florida was immune based on all of the parties and folks that were hanging out at bars. I thought something was happening in your state that I perhaps did not know about, but it looks like it's just irresponsibility, plain and simple. Dr. Adrian Burrows, family medicine doctor and CEO of CFP Physicians Group, thank you so much for bringing us those very important updates and also reminders to wear a mask, wash your hands, and stay away from everyone else. Thanks so much for joining us.